So, hi, I'm here with Barbara Leon. Barbara is an acupuncturist working at the C.R. Johnson Healing Centre, who have got a very close relationship with the High Five Foundation. I'm going to ask Barbara to introduce herself and talk a little bit about the work she does, particularly for people with spinal cord injuries. So, hi, Barbara.
Hi, Nick. How are you? We work with lots of athletes that unfortunately got life-altering injuries through winter sports and other adventure sports. And what we try to do with acupuncture is help them recover as much normal function as they can. And this is a very lengthy process. It takes a lot of patience. It takes a lot of dedication from the athletes and ourselves, but it is so rewarding. We have seen fabulous results.
And Barbara, how long have you been doing acupuncture, and where did you learn this capability?
I graduated from my master's in acupuncture and traditional oriental medicine in 2011 in San Diego at Pacific College of Oriental Medicine.
Yeah.
And then I've been practicing ever since. And then last year I finished my doctorate, also with a focus on orthopedic injuries and female reproductive health. So I've been happy studying all along.
Okay. And maybe tell me a little bit more about some of the work you do, particularly at the C.R. Johnson Healing Centre.
What happens is athletes contact the High Fives organization. They get grants for treatment, and they come to the C.R. Johnson Healing Center to work out with Jack, our trainer. They get massages with Karen, who is outstanding. And then they also get acupuncture with either Kyle Briggs, my business partner, or myself.
Yeah. Okay.
And then we just we kind of have a group going on where everybody is knowing what everybody's doing, and we all work together.
Okay. And tell me about some of the patients or athletes you have treated, and what are some of the symptoms, and so what are some of the outcomes?
Well, the most common symptoms are that bowel and bladder function are incredibly diminished. Also, sexual function is incredibly affected, and that's not counting mobility. As you know, spinal cord injury is very tricky because each person is very unique. And
Absolutely.
I'm not just saying this to simplify it, but you could have the same injury technically that shows up in very different ways in different people. And so you'll have somebody with an upper thoracic injury that is walking no problem, and you'll have people with an upper thoracic injury that, have severe motor impairment. And so what we work with is to try to actually give the patients the most results that will impact their life, their quality of life. So for their activities of daily living, what is the most important for you?
Yeah.
And for some people it'll be, I really want to work on my sexual function. For some people it'll be, I don't care. I just want to work towards at some point graduating from using a catheter.
Right. And could you maybe give me some, specific examples of some of the successes you've had in the treatments you've been employing?
Yes, and before I talk about those, I have to say this is always a group effort. Jack, our trainer, has been outstanding training with other Hawaii, and so is Karen. She's an outstanding, incredibly knowledgeable body worker, and so is Kyle. And so the results that we get, I can't really say, well, this is acupuncture.
Okay.
This is everything that we have done. In terms of function and recovery, we have had patients that have been able to increase their dexterity in their hands and their feet, increase their strength. One of our patients is now walking.
Yeah.
A lot of them increase their ability to transfer. When I first... I have one patient that was my first patient at High Fives, and when he came in, transferring was incredibly difficult. Moving him around was incredibly difficult. He's very tall, very strong athlete. And over the time that we've been treating him, and it's been a year and 2 years and a little bit, and with all the work that he has done, he works incredibly hard. He's there every day, working with Jack, working with Karen, working with myself. And he transfers like there's no problem. He moves around, even though it was a cervical lesion. His hands are a lot more mobile than they were. His control of the movement of the legs is a lot more. So that is incredibly encouraging.
Right, and really it's more of a holistic approach where acupuncture is part of the effort, along with other types of therapies working in. Okay. So, Barbara, I just want to thank you for taking the time to speak to us. It's really interesting, the work you're doing. I'm going to leave some more information that people can check out on the website. But again, thank you very much, and I look forward to hearing more about your work in the future sometime.
Of course, Nick. Thank you. Yes, what I work on specifically with several of my male patients, unfortunately, spinal cord injury is very prevalent in men. I guess men are more hardcore at sports
well,
than
there might be
women.
something up here as well.
And so what I have noticed as part of working with these athletes was that the testosterone levels of a young man are high, and a lot of these athletes were using that testosterone in their sports. As you remove that outlet, then you have all that testosterone is still in their bodies, and now there is no outlet. And so through working with them, we started, opening up and talking about these things, and it turns out it's a huge issue because you have young men that have incredible sex drive with inability to use it. And it's seen in breakouts and temper and things like that excess testosterone that's unbridled will do. And so I thought, well, why don't I start working on maybe trying to course this and see if it can help. And so I started working with one of my patients on this, and just working on the channels affected, distally, and needling the legs, needling the scalp, and we got some really good results. And so right now we have, out of the group of 4 patients, we have 2 patients that are quote unquote sexually normal.
Right. That's incredible.
And and then the other one has had increased sensation and function, to the point which is almost normal. And then for the other patient, that's a lot more difficult, but we still are having results every time we needle in the increase of sensation. When you cannot even feel your genitals, at least being able to feel, oh, well, no, I know that something's there. That makes a huge difference, and it gives us hope.
Well, that's fantastic. In terms of pain management or nerve pain, any specific acupuncture therapies for that have worked?
Yes, and we have worked with all of my patients with spinal cord injury. As you know, many of them come out of the hospitals with heavy doses of nerve painkillers. And it is the consensus that it might not be that great for healing. And so every one of them is in the process of weaning off the medications, or actually completely weaned off. And acupuncture helps a lot with reducing the spasticity and reducing the pain.